If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're going to talk to one of our favorite contributors. She is an integrative rheumatologist. People sometimes write me or call and say, could you please refer me to an integrative rheumatologist within 25 miles of Abilene, Kansas? It's that niche. They think that there are so many integrative rheumatologists that we can find one within just a few miles drive of where they live. But unfortunately, they are few and far between. Today, we're going to talk to Dr. Aly Cohen, who is an MD. She also is unusual in that she is an integrative rheumatologist. That means that she has gone on to take fellowship training in rheumatology. She's board certified in rheumatology, so she can administer all the highfalutin new drugs that are available that are sometimes beneficial in extremis as a last resort. But she prefers to use integrative methods in dealing with patients. And I've referred many of my really challenging patients with rheumatoid arthritis and lupus and various autoimmune conditions to her. And they are eminently satisfied because she has a light touch when it comes to medication, although she knows how to wield them. She is about to give a very, very exciting seminar, which is, I believe it's hybrid. It's in person. It's also going to be virtual. And this is something that we want to alert our audience to. But before we get to that, welcome, Aly. It's a pleasure having you on Intelligent Medicine. Thanks very much for joining us once again. We always enjoy having you.
Thank you, Ron. And once again, thank you for sharing me with your audience. I appreciate you. Thanks.
And I will mention that another extraordinary focus that she has is on the effects of environmental toxins on the body. And she hosts a website, which is called The Smart Human, I believe. And there she weighs in on the impact of environmental chemicals on the body, because when we want to take an all of the above approach, we definitely want to look at the chemicals that can exacerbate or even cause disease. And by detoxifying patients, that's a pathway to wellness. So just give us a little background. What is it that an integrative rheumatologist does differently?
Well, an integrative rheumatologist, and again, I've been practicing Western rheumatology for all these years as well. But the idea that integrative medicine adds more tools to the tool basket is really what I think sets an integrative rheumatologist apart. Because we just learn in our fellowship, which is a board certified fellowship, like as if you were to take, a fellowship in cardiology or rheumatology or pulmonary medicine. This is a 2-year board certification. And it was an interest of mine to learn and expand on what my offerings were for patients. Can I discuss in detail with real information that's science-based nutrition? Can I talk about sleep and how that affects the human body? Can I talk about exercise? Can I discuss Ayurveda or traditional Chinese medicine? or mind body medicine, or understand the gut microbiome and how that relates even to a rheumatologic cases and topics within rheumatology. And so I sort of married the two. But then I added in environmental health, research and studying to understand how that affects the immune system, among other things. And so, I guess what I'm saying is I just feel like I have more training in areas that conventional Western medicine doesn't offer.
Now, we have powerful medications available to treat autoimmune conditions for rheumatoid arthritis, for lupus, for other autoimmune conditions, which I guess fall within gastroenterology, ulcerative colitis, and Crohn's disease. But they come at a cost, not just a expense to the medical system, but at a cost to the human body because they're very immunosuppressive. So when we see advertisements for these things on TV, which are ubiquitous, by the way, there's so many people with autoimmune conditions, there are warnings. There are warnings that say, make sure you get tested for tuberculosis because it's a nightmare if you have TB and your immune system is suppressed. Or make sure that you don't have a parasitic infection. Or warnings that you might be more susceptible to an infectious disease because your immune system is knocked down. So it is preferable, I believe, to minimize dependency on these medications, even though they can be life-saving for some people.
Yeah, I've been a rheumatologist now for 23 years, and I've seen some of the lightest cases and some of the most complicated cases. And I will say that medications are another very effective tool in the toolbox. And I will say this because I was around as a resident in training when these didn't exist 25 years ago. In fact, the first, TNF medication, adalimumab or Humira back in the day, and Enbrel. These were new to the market, new to patients, and everyone was afraid of how they would work and how they would, in fact, change the body in good ways and bad, right?
It used to be that people got too much prednisone. Prednisone was like the magic bullet, but it has, you can't stay on that stuff because it has devastating long-term side effects.
Correct. And these medications have saved lives and they continue to create a great quality of life for so many. And I think so much of the walking well story is that, we can do a lot. And I'm trained to teach on things that actually reduce inflammation and prevent disease and prevent autoimmune diseases in many ways, but also manage flare just through nutrition and diet and sleep for sure, and appropriate supplements. But what I want people to also know as a rheumatologist who's doing this and sees patients suffering, that integrative medicine is taking the best of all of the worlds that you have accessible. So you want to do all those things if you can hack it, and you want to learn about nutrition and fix the microbiome and do all those wonderful things. But if it's not enough, medications play a really great role in helping someone to have a better quality of life. Of course, it has to be thought through judiciously. Of course, you want to think about comorbidities. You want to think about the age of when you start these medications, if there's any problems with fertility or those kind of things. But I will say, in many ways, these medications and lifestyle added together reduce this inflammatory component of many people and their lives and kind of rights the ship. The goal is really to bring that inflammatory condition, if you're treating an active lupus or rheumatoid or any autoimmune disease, down to kind of where everyone else should be, right? Quieted down. The fear of immune suppressing really is, certainly can be real, but for those who are maintaining really good lifestyle and nutrition, to me, I have not experienced so much of that as a problem, being immune compromise and susceptibility when they're actually bringing, these medicines on board.
So the use case for a natural approach is that even if you have to rely on medication to suppress the inflammation or to keep the condition in check, that you will remain healthier. Your immune system will be less susceptible to invasion by unusual fungal disorders or weird bacterial infections, because we're actually seeing a lot of what we call iatrogenic cases ending up in the hospital. A whole new style of patient. Patients are on multiple immunosuppressive drugs who develop these weird infections. And so, we do want to keep people as healthy as possible, even if they need to rely on medication.
Yeah, and to be honest, as someone who studied anthropology and evolution for 2 decades, if not more,
That's two of us, by the way. You were an anthro major?
I was an anthro minor, medical
Okay.
anthropology, and it really did
Yeah.
shape the way I looked at anything
Yeah.
moving forward in college on beyond. Because what it really taught me is that human beings in modern day times are really affected by lots of things that never were a problem for evolutionary times. For 4.4 or 5 million years, we've been experiencing, human evolution, but it was only in the last 100 years that we've had 300,000 synthetic chemicals added to our lives in food and water and products. But we're also nutritionally really insufficient. And so when I talk about things like in my book or when I post on the Smart Human on my platform and all that, it's not just taking away environmental chemicals, which is a lot of my work, as you know, in rheumatology as well. It's also what are we adding in from an integrative and nutritional perspective to make the body work better as it has for millions of years. So you know, and I know that people are deficient in vitamin D chronically. We're deficient in B12
Which is
often.
a big deal. Vitamin D is a very crucial
Absolutely.
nutrient when it comes to autoimmunity. Many conditions are much more likely to occur in the setting of low vitamin D and actually are ameliorated when you replete the vitamin D.
Absolutely. Even COVID, we have new studies, even though most of us knew this already, there was
Mhm.
such a robust amount of literature showing that those who had low vitamin D walking into the COVID pandemic actually had worse morbidity and mortality, meaning worse outcomes if that alone was monitored and looked at. So we do know vitamin D has roles in everything from heart disease prevention, to growth and development to bone health in women. But it also is very important to the immune system. So when you just take that one piece and you make that stronger in someone, you make it high normal blood levels, for instance, not low or medium, but high normal, you can actually start to see that when you give the body certain things that it needs, clean water, clean food, nutrition, exercise, movement, good sleep, less toxic humans, that are emotionally bringing people down, you can see that that piece is very important, along with whatever you might add in from the outside as a therapeutic.
Well, we now know that there is such a thing as a pro-inflammatory diet, and there
Mhm.
also, conversely, there's also something like an anti-inflammatory diet. So, how important is the food we eat in terms of the expression of an autoimmune condition?
It's a great question. So we know that food can really add so much value to human health, but it can also taketh away, right? So what we really want to be thinking about, and you're talking about food, I also talk about water. Drinking water is
Hmm.
completely underestimated when it comes to an input into the body, particularly the gut microbiome. But when we're talking about what we put into our bodies, we're sort of more talking about, is it a fruit, a vegetable, is it whole foods, or is it processed or ultra processed? What I like to have people think about is not just that level of conversation, but whether or not there's chemicals in the foods that they eat and drink, and whether there's chemicals in the water that they're drinking, and how to pull that back and how to actually reduce that. Because again, we want fiber, we want whole foods, we want less processed foods because that innately will have less chemicals in general. But then you have produce that has lots of pesticides and fertilizer chemicals, and you have drinking water that's kind of fairly being, not even great, filtration with the pitchers or, even on the refrigerator door like carbon block, but you can take it to another level even within very reasonable cost. So it's kind of like, where are you? Where do you need to work on slowly? Is it the big picture diet issues? And then can you incorporate even a different level where you're looking at quality in terms of environmental chemicals on the food and drinks that we use?
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear nasal spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening, and thanks for supporting our sponsors. They are what make intelligent medicine a free resource to you with great guests like Dr. Ailey Cohen. Well, we know, for example, that pesticides and herbicides can be carcinogenic. In fact, there's this big case, and they're now settling it with Bayer, the makers of Roundup, a.k.a. glyphosate. And if you develop non-Hodgkin's lymphoma and you've had exposure to that, you can sign up and get part of the booty because there's been a certain amount of money set aside. But short of developing overt cancer, do these chemicals have the potential to trigger an autoimmune disease like, let's say, multiple sclerosis, rheumatoid arthritis? We can tick off lupus, all the various autoimmune diseases that you end up treating.
Yeah, so pesticides in and of themselves were designed to kill microbes, right? That's what they were designed for in the fields. We spray them, herbicides, glyphosate, one of the most popularized, but also not just legal cases involved, but because it's just so pervasively used. It's the number one herbicide used in the United States. And when you think about where does the immune system actually start in the human body, it's the gut. It's 26 feet of bowel. We have, if you think of it as just a tube of 26 feet, it's the interior of that tube. It's sort of like if you were to put bread, butter on bread, it's that inner lining of the tube that's a very, very thin layer of microbes that we've been living with for millions of years in a healthy gut. And then you have some cells on top of that create mucus as a layer, and then you have the cells underneath it, that's the epithelial layer. And so it's like a sandwich of protection that the gut uses as food transits. We get the nutrition from those foods, but we can also be affected by the pesticides that knock off the good guys that should be there to protect that lining. And so when you talk about foods, you want to think about, well, what is, I think, there's no neutrality, generally speaking, to what you do, right? And in life in general. When you eat something, do you think that that's going to knock off some of your microbiome, or is it something that's, really not a big deal most of the time, right? So I think that when you get kind of 80-20 and you start thinking about what you eat and drink, if you do more good than bad, or you kind of do more clean than not clean, you start to get a really good habit. You start to actually have positive reinforcement. Your gut gets healthier, and then therefore your immune system gets healthier, because now your gut microbiome is hardy and it's working for you. It's protecting your body in many ways through that gut lining.
Yeah, there actually is some research that suggests that individuals who take a lot of antibiotics, which is common among kids, they get these frequent ear infections or strep throats, they're given antibiotics, that it has a lot of downstream effects on their immunity, on their brain development, even on their likelihood of developing obesity, because the gut is such a determinant of overall health.
Yeah, I mean, the gut plays an incredible role. When you look at a lot of autoimmune diseases, scleroderma, Crohn's disease, ulcerative colitis, lupus, when there's retrospective studies looking at the gut microbiome, there's what's called dysbiosis, meaning there's not this sort of very balanced microbes of, and we have lots of things, bacteria, mold, yeast, viruses, all really hanging out in a very balanced environment. Once there's unbalanced environment where there's too much overgrowth of one or the other, that's when there's links to immune disorders. Now, mind you, that's not the only thing that affects whether or not you develop an immune disorder or autoimmune diseases, but it's a really big area where we can all actually proactively do something about it. And that's what I write about. That's my books are about, like Detoxify. I want people to actually do what I do. Scaling up what I do in my office. As you said, there's not many rheumatologists, let alone integrative rheumatologists. What I try to do is actually write about this, post about it on my social media so that people can do what I'm doing in my office here in Princeton, New Jersey. And so, to be honest, there's just so much more that we can do than we thought we could. And that was my job, as I see it, is to really put people in the right direction to do better when they know better.
And you've written several books. One is, as you mentioned, it's called Detoxify, the Everyday Toxins Harming Your Immune System and How to Defend Against Them. It's published by Simon & Schuster, which is kind of a big deal. I know a little bit about the publishing industry, and I had a couple of books published by Simon & Schuster, but it is really tough to get it. That's in the belly of the beast of the publishing industry, and it's a controversial subject. And so kudos to you. Also, HarperCollins published your book in the UK. And then there's Oxford University Press, a prestigious publishing company, Non-Toxic Guide to Living in a Chemical World. So what we're teeing up are some of the subjects that are going to be covered in your Smart Human event that's coming up later this month. So it's a hybrid event. So people can come, and you're in New Jersey.
Yeah.
I'm in New York. So it wasn't too hard for me to sell patients to go a few miles down US 95 to go see you. So people in the New York metropolitan region and in Jersey, Connecticut, even Pennsylvania, they can physically attend, right? And
oh yeah,
right.
yeah. Actually, it's going to be a fabulous. Look, this is my inaugural event. I've never been a producer, but I woke up one morning when I was hearing really bad health information on the news yet again, and I felt compelled to do what I do. When I fight some injustice in my ears, I thought I'm going to pull together some of the smartest women's health physicians that are specialists as well as integrative medicine trained from across the US with the sole mission to educate people directly, to the public. In other words, no third party, no TikTok, no influencers, people who have had hands-on clinical experience for the last 20 to 30 years. And so they're flying in these folks, and they're not doing it for the money, I can assure you. They're doing it for the mission. Dr. Torona Lowdog.
Oh, she's fabulous. Yeah.
She's amazing, right?
Yeah.
She was my mentor, but she's going to, kick off the whole program in person. And then I have Dr. Jennifer Ashton coming in from Boston. She'll talk about menopause and HRT. I have, integrative neurologist from New York City who is also on staff or on one of the faculty for NYU. She'll be talking about dementia. I have integrative cardiologist, Vivian Caminos, integrative endocrinologist.
Vivian, I know. Yeah, she's great.
Vivian, she's great. And Dr. Benito, she's retiring. And I wanted to capture some of the most incredible colleagues who I've learned from, that I respect, who are really just solid, and bring them into a room. However, I didn't want to waste this opportunity. So I've been really reaching out to academic leaders, deans of nursing schools, deans of, all the different teachers locally, high school teachers in Princeton. I've reached out to all of Princeton University coaches. I want people to understand that this is a learning event. It is supposed to be fun, but really good information. I've printed out notebooks, so fill a room, buy a virtual ticket and fill a room with 100 people. That's fine with me, because it's really about getting this information out there. And so that was really the mission and the goal.
So for people who can't attend in person, there is a virtual option, right?
Yes, and that's through Zoom, and you don't even have to be there that day. There's lots of people who have,
so be pre-recorded, and then you can opt to listen to it, because some people, frankly, it's on a Friday, so some people say, I'm working, or I have to babysit that day.
Yeah.
But they can listen to it at their leisure, just like
for sure.
Netflix.
It's on Saturday, April 25th.
Okay.
And it's an all-day event, but people who are getting a virtual ticket will be able to not only watch and dabble in as they like, but they'll be able to watch it. And I think it's going to be available for 3 weeks, to jump in and see whatever they missed. And it will be that same virtual ticket price that they can, and you can also offer your audience a discount. And I'm happy to share that.
Oh, okay. It will certainly make our intelligent medicine listeners aware of that option. And, just talk to our producer, and, maybe we can wangle that. So we've laid down the groundwork for our discussion in part 2. I want to get into some of the supplements that you think are particularly crucial when it comes to autoimmune disease. We don't want to give a cookbook, because every patient is individual and requires personalized care. However, there are certain verities when it comes to supplements. I think too much, and you know this as well as I do, too much of the time in conventional medicine, when patients are taking medication, doctors just say, oh, don't take any supplements. We just don't know how they could interact with the useful medication you're taking. And then they think it's an either or, that it's binary, that you either do conventional medicine or you do alternative. And as you say, your practice is integrative. It's the best of both worlds. Putting those together is your forte. And we'll talk a little bit about that when we return. I'm Dr. Ronald Hoffman. Our guest today is Dr. Aly Cohen. Once again, give the information about the Smart Human and also about the event.
Yes, it's Saturday, April 25th. It's the first The Smart Human Health Summit. This year's theme is Women's Health. And I'm pulling in all these wonderful clinicians and authors and researchers from across the country. And you can check it out on Instagram. Thus, at The Smart Human is my handle, The Smart Human, as well as thesmarthuman.com. It's both virtual and in person. So I hope people will check it out.
Okay, it's the hottest event in integrative medicine in the Northeast this spring. I can vouch for that. I'm Dr. Ronald Hoffman, and we'll be right back with more of today's Intelligent Medicine podcast with Dr. Aly Cohen.